Um, we are hitting noon here in just a second. So I was going to thank you. So today we're going to talk at the listening lunch about wellness and self-care. Dr. Rachael C. Marshall and Dr. HyunGyung Ju, thank you so much for giving us your time. And I look forward to today. Thank you so much.
Okay, hello everyone. I'm Dr. HyunGyung Ju. I'm assistant professor in counselor education program here at Sac State. And with my school counseling background, I specialize and do research in bullying, school connectedness, mindfulness, wellness. And I'm very excited to talk about wellness and self-care with Dr. Marshall today. This is an area that I am very passionate about, and I actively incorporate wellness in my teaching and my research. Dr. Marshall?
Hello, everyone. I'm Dr. Marshall. I'm in the career counseling specialization, and most of my research is dedicated to self-care and wellness and how that impacts our career development. If anyone's had a class with me, some of the breathing exercises we do there, we're probably going to do here today as well. So you'll be old hats at it. But I'm excited to share this day with you. Thank you, Dr. Rivas, and thank you, Dr. Ju, for doing this with me today. So today we're going to talk about impairment in the era of COVID-19. We're going to explore self-care and wellness, and then we're going to talk about what this means building a community of caring. So before we really discuss some of what's happening in relation to how you take care, let's talk a little bit about burnout, which is kind of a dreaded word in a lot of ways. And inside helping professions, we experience a lot of burnout. We have some of the highest rates of burnout across many different professions, but it's been complicated and impacted by COVID-19. So maybe a scale of 1 to 10, how many people have experienced burnout? 1 being, no, I'm good, everything's perfect, sunshine and rainbows. 10 being, please get me out of here, I just need a nap. Where are we at? Can we put that in the chat? Yeah, we got some high numbers. 9, some 10, some 3, yeah, some 8. So excellent. Yeah, we're kind of all over the spectrum, right? And it depends on what's happening that day that's actually impacting us too, but we're maintaining a pretty high level of stress, and stress is something that we need. We move forward with stress. It sometimes shows up as over-engagement. We might feel overactive. We might feel this sense of urgency or hyperactivity, but it leads to a loss of energy. Whereas burnout is characterized by this disengagement. So this elevated chronic stress for so long starts to burn us out. We start to feel disengaged. Our emotions start to be blunted. We might even have feelings of hopelessness or helplessness. And this usually damages some of the emotional pieces within us. So this is some of the things we're going to talk about today in relation to how do we start to work with this area of burnout and impairment. So here's some things that you might be feeling. It's vicarious trauma. So we're connecting with our client's pain, and it impacts our empathy and our health. And this actually is coming in a lot because we're having parallel experiences with our clients, right? Some of the same things they're going through, we are also going through. And while the trauma is happening around us, it's also happening in the room. And when it's happening simultaneously, we can sometimes engage with that trauma in a way that's not as healthy, that doesn't have the professional boundaries that we need as helpers in order to move forward. You might also be experiencing counseling compassion fatigue. So you might have this deep sympathy and sorrow for your client, and you feel like you need to resolve that suffering, a deeply strong desire to alleviate that pain, maybe even feeling like it's your sole responsibility to help your client. This leads to extreme fatigue in relation to connecting with your client because you're in the same amount of pain as your client, and you feel this deep responsibility to help. Something that COVID-19 specifically is now bringing up is this idea of caution fatigue. So when people have little motivation or energy to continuously comply to safety guidelines. So we have all of this stress around us, and it's hard to then process new information. We just recently got some new information where we're double masking now. And it can be challenging when you're in this elevated stress area to then integrate this new information into what's going to keep you safe. So we're getting a lot of different types of fatigue, of trauma, of impairment in relation to our work. And COVID-19 and the pandemic is moving within our counseling relationships and our self-care interests because of many impacting factors. And some of the main ones that have shown high correlation to burnout have been prolonged exposure. I've been reminding some of my supervisees to be gentle with themselves around this time because we're actually coming up to an anniversary. This has been a prolonged exposure with the pandemic and the drastic changes, but we're coming up to when things really started to heighten and change. This is a different type of grief that is also coming up for us. And this prolonged exposure decreases our energy and this ongoing sense of responsibility that we have to continue helping others. And we need to, but we also have to take care of ourselves. We also have life disruptions, large life disruptions, changes in schedule, routine, managing life responsibilities. I know I saw a meme recently that said, I feel like I am losing control, and the only way to stop from losing control is to attend a Zoom meeting about not losing control. And that's exhausting. There's just this exhausting element to this. So we're all experiencing these feelings. And I just kind of made you sit with those feelings for a second. This drastically changing world, you're probably finding your usual ways of coping might not work as well as they used to. Self-care has become kind of a buzzword. And so the question we're now asking is, how do we really engage with self-care in a way that's healthy and fruitful, and not a way that maybe makes us feel guilty or maybe doesn't help us as much, or maybe even we're feeling a little resentful to the idea of self-care in general because we're exhausted. So let's take a moment before we move into this next area of exploring how impairment and wellness move together and just do some breathing, because I just talked about some very stressful stuff, right? It's stressful, it's heavy, it's hard to work through because probably a lot of it hit home for how we're all feeling. So let's get comfortable in our chairs, maybe with your feet flat on the floor, and you can close your eyes or soften your gaze, but we're going to do something called 5-7-9 breathing. And what's where you inhale to the count of 5, you hold that breath to the count of 7, and then you exhale to the count of 8. Let's try that together. So inhale, 2, 3, 4, 5, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8, 9, and 1, 2, 3, 4, 5, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8, 9. One more time, 2, 3, 4, 5, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8, 9. You might notice your shoulders dropping a little bit, your neck feeling a little looser, a quick little breathing exercise to remind us that burnout and impairment are processes. They are a process, they're parallel to the wellness development process, and they actually rest on a continuum between wellness and impairment. So as we engage with this continuum from wellness to impaired, which is a natural progress throughout our time working as helpers, it's always good to have those moments to check in on our process of wellness and on our process of impairment to see exactly where we are. So when we talk about the buzzword of self-care, we're also kind of demystifying it. It's a holistic wellness strategy. It's deliberate in the way that we engage in it, so it's intentional, and it's a continuous plan, which means that we're also updating it from time to time. We talked about how potentially things aren't working, or coping mechanisms from the past aren't working the way they used to now. And that's because your wellness plan is always evolving. Types of self-care, yes, a bubble bath and some champagne, but that's not always what self-care is. That's not always how it works. Self-care is many times boring, many times challenging. Self-care is as simple as waking up in the morning, changing your bed sheets, changing from your pajamas, at least from the waist up, to your business casual clothes or your day clothes, attending to your general health and wellness, attending to the things that you need in order to survive are also part of that self-care process. So wellness is defined as a continued process of making choices to maximize human potential. So your self-care and your wellness is a choice, but it's also a process and it is intentional. And we're going to talk a little bit more today, not just about why it's important for ethical book practice, but also really intentional steps that you can take in order to make sure that you're attending to your wellness.
Okay, thank you, Dr. Marshall. So, from now on, I'll talk about what is wellness and kind of redefine or restructure some strategies you can use to enhance your wellness in this pandemic. So there are many different definitions of wellness, and we chose definition from Myers and colleague. So definition of wellness is a way of life oriented toward optimal health and well-being, in which body, mind, and spirit are integrated by the individual to live life more fully within the human and natural community. Ideally, the optimal state of health and well-being that each individual is capable of achieving. So, by definition, it says we can achieve wellness by putting consistent effort, making healthy choices, develop a healthy lifestyle. At the same time, we acknowledge that optimal state of health or optimal state of well-being can look very different by, especially compared to pre-COVID. Because it's been almost a year since this pandemic started, and everyone lost something from COVID, like it can be loss of jobs, loss of loved ones, loss of in-person interaction, and some existential questions about meaning of life, fear, anxiety, ongoing stress, and social injustice. We are definitely all struggling. And at the same time, because of all these questions, challenges, struggle we are facing, this can be a really great time to revisit the idea of wellness and reflect and maybe restructure your activities that you engage in wellness. Again, we are not talking about this ideal, optimal state that we were in pre-COVID-19, but how can we enhance our wellness in this time? So let's think about how can I meaningfully and effectively engage in my daily life. So there are different wellness models, and today we chose this model from Myers and colleague, the indivisible self. So this indivisible self model is one of the evidence-based model that is frequently used in counseling field. So in this model, we look at the whole person, body, mind, spirit are integrated and inseparable, indivisible. And this is an ecological model that it considers context we are in. So local context, institutional context, global context, and lifespan. So we need to consider our wellness considering the context we are in. And in this model, there are 5 different self domains, which are creative self, coping self, social self, essential self, and physical self. Dr. Marshall, next slide, please. Thank you. So we're going to, in today's webinar, we'll talk about each domain and share some ideas how to promote or enhance wellness in each domain. Next slide, please. Thank you. Okay, so the first one is creative self. Creative self includes the strategies that uniquely address the joys and challenges with our life demands. So in this creative self, it includes our thinking, thinking style, emotions, like being aware and getting in touch with feelings, being able to experience and express your feelings appropriately, control, work, and positive humor. So, if we think about this creative self in this context, the COVID-19, emotions, different emotions like anger, anxiety, frustration, fear, sadness, and grief and losses. Again, losses can be like losing job or losing someone we love, care, or just lose of in-person interactions. Job uncertainty and lack of job security, and this ongoing safety concerns. So here are some wellness promotion ideas that I'd like to share. And these are just an example, it's not the answer, but if you find that some ideas would work well with you, you may try some ideas from it. So first is recognizing that you are not your thoughts. Add, I'm having the thought that in front of your thoughts. So this is from acceptance and commitment therapy. So when you have this thought, I should be perfect all the time, add, I'm having the thought that I should be perfect. It's kind of like a way that you recognize thought is just thought. Another example, if you feel like I am powerless, you may add, I'm currently having the thought that I am powerless. The next idea, the power of yet. So this comes from the growth mindset. So add yet at the end of your sentence. So for example, rather than say, I did not have a solution, add yet. I did not have a solution yet, but with time, with some progress, I may be able to have some solution later. So it really helped us to be more hopeful, flexible, rather than having a fixed mindset. Emotions. Again, we are going through or experiencing so many different emotions in this COVID-19 pandemic. Understand your emotion, for example, frustration. What types of situation make you most frustrated? Kind of these questions really help you understand your emotion better. And remember, there is no right or wrong way to feel during this pandemic. All of your feelings are valid. There's no right feeling or wrong feeling or good feeling or a bad feeling. It's all valid feelings. And also, if you are feeling really stuck with your anxiety or fear, experience your feeling as a wave. So come and go. So remind yourself it's temporary, it's not permanent. Emotions comes and go while you're validating your emotion. And also, I want to emphasize this one. Kind of distinguish between things you can control versus you cannot control. During this pandemic, there are so many things that we cannot control, and that often leads to anxiety and frustration. So kind of reflect, when you feel really angry or upset, frustrated, reflect, is this something I can control? Or, is this something I cannot control? So, if that's something you can control, you may change your attitude, you may change your behavior. If that's really out of your control, we may need to let it go because that's something you cannot control, right? Or, you may broaden your perspective by reading a different book, journal. In terms of work, you may name a strength you have in work and explain how that has helped you outside of work as well. And some, positive humor, we all need it, read or watch something funny. Okay, Dr. Marshall. Thank you. Next is coping self. So coping self is how you respond to life events, including those with negative consequences. So very relevant to current situation. So coping self include leisure, activities that you do in your free time, stress management, self-worth, like accepting your positive qualities along with imperfections, and realistic belief, understanding that perfection or being loved by everyone is impossible, like having the courage to be imperfect, having the realistic belief in this pandemic. And as we reflect coping self with COVID-19 pandemic we are in, definitely this chronic ongoing stress, change of structure in daily life. Some of us working from home, like we do like school related work, family, socializing, leisure, relaxing, everything happened as like one place. And like uncertainty during pandemic. And having realistic belief in context is also very relevant to this COVID-19 pandemic we're in. So some ideas to promote coping self. Set aside some time throughout the week to do something you really enjoy. And you may engage in self-reflection by keeping a journal. You may practice some kind of mindful meditation. Also, you may think about a time when you practice forgiveness and what the experience was like for you. And I also really want to emphasize this one, like treat yourself as you would treat a good friend. How are you talking to yourself? We all need to give ourselves credit, managing ourselves during this pandemic. So be kind to yourself. You are doing best you can in this difficult time. So rather than like treat yourself like, with harsh self-talk, be kind. Like, I know sometimes it can be difficult. Let's try to treat ourselves as we would treat a good friend. Along with that, you may implement like daily positive affirmation. And also schedule a break between Zoom sessions. Like actively schedule maybe 10 to 15 minute break between Zoom sessions that you can like take a walk or you can take some time for yourself. And with stress management, share your struggle with others. Oftentimes when we are really stressed, we think that like I'm the only person like, who is struggling. But, many times others may go through similar experiences. So try to share your struggle with your family or friends or someone you trust. And also radical acceptance. So radical acceptance is from DBT, and accept the new reality. So when you're really like, stressed out or struggling, rather than like avoiding or denying it, accept radically, and then think from there. So I'm in this situation. I don't think it's okay, but it's what it is. And then kind of accepting it and then think, so what? So what can I do from now? So radical acceptance is also really great strategies you can use when you are under a lot of stress, or if you find yourself like denying or avoiding the situation. Next slide, please, Dr. Marshall. Thank you. Social self. Social self includes social support through friendship and intimate relationships. It's definitely very related to COVID-19. lack of in-person interactions, which is related to isolation, loneliness, and sometimes interaction exhaustion. The people we live with, we really like them, but 24/7 togetherness can create some new stress and tension as well. So some wellness promotion ideas, like find some creative ways to connect with others. You may schedule like virtual quiz night, virtual book club, virtual lunches, or workout. Like, you may schedule virtual workout together and then do that together. Participated like virtual social activity with friends or family. Or you may try to like find new like online support group like that and try. Or you may also like draw the representation of your current relationship in an effort to examine the quality of your connectedness with others. So you may reflect like, your your interpersonal relationship and quality of it. And also practice communicate openly and honestly with each other. We have two more self. Next one is essential self. So it is meaning-making process in relation to self, life, and others. So under essential self, it includes spirituality, gender identity, cultural identity, self-care. And during this COVID-19 pandemic, some gender roles in the workplace and at home, gender inequality, healthcare disparity, and some changes in faith-based or spiritual gatherings, and definitely changes in self-care. What worked for you before may not work anymore, after COVID-19 or during this COVID-19 pandemic. So some wellness promotion ideas. You may kind of reach out someone close to you and have conversation about these issues like spirituality, like cultural identity, gender identity. You may practice daily meditation in a way that works best for you and create a self-care plan. Or practice like gratitude practice. You may, before going to bed, maybe you can think about 3 things that you are grateful for on that day. And I have been personally practicing this for years, and I really found it very helpful. And there are many studies on the positive effect of this gratitude practice. So this gratitude practice can really help you while you engage in finding meaning about yourself, life in this pandemic. Next, the last one is physical self. Physical self refers to physiological process that influence your development and functioning. So it includes exercise, nutrition, and in relation to COVID-19 pandemic, limited physical activities or inactivity, like we do not move that much compared to pre-COVID. Food insecurity, access to healthy food. So some wellness promotion ideas. You may find some new routines that you can do, maybe at home. And do stretching exercises throughout the day, especially for those who work from home, between meetings. Remind yourself to do stretching. And you may try new healthy food, drink a lot of water, or maybe you can practice mindful eating, eating slowly. Next slide. Okay, so those were 5 domains or 5 self in this indivisible self model. And I share some ideas that you may try. Again, that's not the idea that you should try, but some ideas that I may suggest. So wellness check-in. So this is some activities that I do with my student in my class. And I know that, in audience, there we have some current students, previous students. So wellness check-in, the left one in the slide is what I kind of created for this semester because we are being virtual learning format. So students can put scores on the table each week, and it is like converted to table. You can see in the chart. You can see that the students can view their score in a visual like chart, and some students want to track their wellness score throughout the semester. So I created version 2 of this file that they can track their wellness score like each week and throughout the semester as well, like along with the average score. And if you'd like to have this file, feel free to email me at joo@csus.edu. Nothing fancy, but I'm happy to share this with you. And the right one is example of wellness wheel. And there are many different versions of it. I usually, when I use this wellness wheel, I usually ask my clients or students to print that out, and then they color to the level that they feel like they are in each domain. And again, good way to visualize your wellness score at that moment and see how balanced or imbalanced your wellness in that moment. Okay, next slide, please. Because of time, we will not make a wellness plan in this session, but I really encourage you to create your own wellness plan. So you may make a plan, a daily plan or a weekly plan, and then actively schedule activities that you can do to enhance your wellness. So for example, goal is to increase connection with your friends. Then you may come up with a plan, maybe call 3 friends this week, or it can be more specific, call my friend on Tuesday, Thursday, Saturday night. So using a SMART goal, specific, measurable, attainable, realistic, time-bound, I really encourage you to create a plan. Again, it can be daily or weekly plan that you can keep practicing. Again, this wellness is an ongoing process that you are putting a conscious effort to improve your wellness. Thank you. And next is Dr. Marshall.
So we're working together to understand wellness and burnout. We're exploring how we actually attend to this specifically with these 5 factors. We're asking for a plan, but we're also not asking you to do it alone. A lot of the development of a self-care currently, or even wellness currently, has taken on the lens of a very westernized perspective and very individualistic. Now, this is all based in the idea and came a lot from Maslow's hierarchy of needs. That according to Blackstock in 2008 and her presentation in 2014 was actually co-opted from the Blackfoot Nation. So remove the community element of our wellness and our self-care. An expansive concept is not just that we have all of these needs met, but that we're also engaging with each other on these needs. This is very important in the era of COVID in relation to our responsibility and our respect for others. So we're all in this together. We're thinking of others as part of our wellness experience, to hold us accountable, to help hold us accountable, to engage with the wellness of our culture and our society in general. And in this age, that seems very important. Specifically, a quote from Cindy Blackstock. It's understanding one's place in the world and acknowledging it. It's realizing each day that I've been blessed with basic necessities and giving thanks for them. It's doing my part to help my community and the greater good. Hopefully these teachings practiced by my generation will inspire the next to take hold of them so they will endure. So In our meeting today, we're not just talking about how are we individually going to maintain our wellness, but how are we going to help each other maintain our wellness? This lends itself back to our ethical practice and that we are responsible for maintaining wellness, but helping our fellow colleagues check in on their wellness is our responsibility as well. So within this idea of community care, some of what we're working to do for each other and with each other is engage in empowerment, identifying strengths and resources that can help us and those around us engage in self-care, identifying the social, political, economic, and cultural factors that affect our wellness. At an appropriate developmental level, depending on who we're working with and how we're working with them, help identify the external barriers that affect that development. Whenever we make these types of wellness goals in classes, I always check in with them throughout the year because at times we've realized that the goal that we had before doesn't really match with what we're doing now. So you have to check in and continuously evolve and develop the self-advocacy skills and action planning to move forward and empower yourself towards wellness and empower the community to embrace wellness as necessary for our survival. A note on wellness, if you Google it right now, you'll probably get an image like this. But I want to remind you that burnout is not permanent. You are not a match. You're a fireplace, and sometimes your embers burn down. To clean out a fireplace, you don't have to do it alone. Sometimes you need to call on an expert to help. Sometimes you have friends who help you understand what you're going to do with this fireplace. As someone who recently bought a house, you don't just throw the fireplace out of the house, right? You tend to it, you try to make it better, you rebuild it if you need to. And this is what we're doing when we're engaging in the process of wellness and moving through the continuum of impairment and wellness, is that we're tending to our flame, and we don't have to tend that flame alone. Everybody who is at this symposium, everybody who's working with you at work, your family and your support systems are all in this together, and we have that responsibility to each other as well. So we'll open it up to final thoughts, to reflections, to questions that you might have and you want to share. Of course, we'll share these PowerPoints with you. We have extra resources as well as our contact information at the end.
So if everyone would like to use the Q&A button, feel free to put some questions in. The chat also works, but we'd be happy to take some questions. This was an excellent PowerPoint and very needed today. Seeing as how there are no questions, any other final thoughts or reactions that the group listening would like to share?
I saw the chat or question. Yeah, I'd be happy to share the wellness check-in file. It's really not fancy at all, but I'm more than happy to share. My email is joo@csus.edu. It's my last name, joo@csus.edu. And yeah, feel free to email me. I'd be happy to share the file, and feel free to add it because I put 7 dimensions of wellness in the file, but some uses the different dimensions of wellness. So feel free to add it as well.
So far, we have a thank you really needed during this time. A question from Fatima. What would you all recommend for those that don't have time to self-care due to the intensity of work?
You can go first, Dr. Marshall.
That's a great question. It's challenging to carve out time within a busy schedule. And so I like to think about self-care as not necessarily needing huge chunks of space, but can I take 1 minute? to do something that's helping me, or 2 minutes. Many times, if it's just a quick breather, we can do that. But also remember that waking up in the morning, making your bed, brushing your teeth before you go to sleep, eating your food, these are all part of self-care too. So you are taking care of yourself. It's just challenging to get maybe the more beautiful ideas of self-care. But if what I've actually done is created a reminder on my calendar that's like, this is your 5 minutes or your 2 minutes between meetings, and this is we're focusing on breath today, or we're focusing on gratitude. And I actually carve it out of my schedule, and that's challenging. But I also recommend, if it is possible, because I know schedules are challenging, saying no to some things when you need to. And that can be really hard, especially when you have the pressure of needing to get things done in our society. But asking those people you are working with, delegating workout, and being sure to engage others in that, to ask for the things that you need as well, and carve that space out.
Yeah, I definitely agree with Dr. Marshall said. And as I was like reading this question, I was thinking like one of self-care I am trying to do for myself. So like in my class, virtual class, we have 10-minute break. And I know that I can do many things like checking email, responding to email, but I decided to like take a short walk, or like drink a water. So try not to think self-care as something big, but like think about how you can incorporate, during the time that you have, and maybe like some gratitude practice or mindful breathing practice like that. Like before going bed, like you can just maybe spend a few minutes before going to bed. So kind of like think about what do you need, like in all these domains. It may feel a little intimidating if you think like you need to improve all of domains at the same time. Like check in with your body, check in with yourself, what do you need? And then kind of like, listen to your body and your mind, and then, choose one small activities you can do at that moment.
We have several notes of appreciation. This is very needed right now. One from Thomas says, I'm very thankful and grateful for this meeting with you both, and wrote notes on everything that was shared and look forward to using these tools. So Dr. Marshall, Dr. Ju, thank you so much for this presentation. We greatly appreciate it.
Thank you all for joining us today.
Yes, thank you so much. And we're happy to share the PowerPoints as well if y'all would like those.
No final questions. So yes, that's excellent. We will share it. We have this recorded. We'll make sure to share the recordings from the day, this one included. So thank you again.